Okay, welcome everyone. Welcome to this exciting webinar on market assessment and shaping for sustainable procurement. My name is Sanjay Saha. I am the founder and CEO of BSkilled. This webinar is jointly hosted by SAPICS and BSkilled, and this webinar is predominantly for Sub-Saharan Africa. We have an excellent panelist lined up for today. But before we go and understand who they are, let us have a quick understanding of the ground rules for today's webinar. So the webinar is going to be about 1 hour and 45 minutes. And we will award the certificate of participation to anyone who spends at least 70 minutes in the webinar. So once the webinar is finished, we will check the statistics and then the certificates will be shared. The webinar is recorded and the recording and the slides that are being shown will be shared with everyone who had registered for this webinar. Next. Yeah. So a quick overview of both the organizations. So SAPICS is a recognized partner of APICS as part of the ASCM network for over 50 years. It's based in South Africa and it's the premier supply chain professional development across sub-Saharan Africa. SAPICS's mandate is to support the continual development and overall benefit of individuals and organizations in the supply chain management profession. BSkilled is a global provider of learning and networking opportunities for public health professionals. We have a scientifically backed curriculum developed by experts and which is delivered through affordable learning systems. BSkilled aims to support professional development of health professionals, especially in low and middle income countries. For today's webinar, we have experts from the global north and south. As you see, we have Jan Komska from UNICEF based in New York. He's the contracts manager in the supply division. We have Katrina Tyson. Sorry, Katrina, there's an extra E for whatever reason on your name. Let's remove it, team, from the back end very quickly. Katrina is the supply chain practice lead at Health for Development, and we will, of course, learn a bit more about her. Then we have Ard, who is Ard Van Dongen, who's the Strategic Supply Chain Director at PFSCM. Then we have Linda Ashiang, who's the Program Manager of Market Shaping at Africa Resource Center. And then we have Wanjiru Munene, who's the Regional Manager for Market Access and Shaping at InSupply Health. So as you see, we have convened experts from all across the world so that you can learn from them and get a better understanding of market shaping as a practice. In terms of the agenda for today, there are 5 key sections which will be taken up by these experts. So we will hear from Wanjiru first, then go to Ard, then Katrina, Linda, Jean. Then there will be a Q&A session. For the Q&A, you have a Q&A box. So you can add all your questions on the Q&A box or the Q&A widget. And then we will take some of the more interesting questions during the webinar. I'm sure there will be many more questions than we can answer. So eventually all those questions will be compiled and a final Q&A document will be shared over email with everyone. Then there will be reflections and recap and conclusion by Claire, who's the marketing manager at SAPICS. So without further delay, I would like to invite Dr. Wanjiru Munene, who is the market access expert at InSupply Health, for the first topic. I would request all other panelists to stop their videos so that we can have spotlight on Wanjiru. And then as and when you speak, we will have you on as a spotlight. So Wanjiro, before you begin your section, I would like to ask a question to you, so that that guides this section, and so that everyone understands what we're talking about. So I want to know from you very specifically that what is market assessment and market shaping, the terms that we are using for these webinars, for this webinar, and the terms that are used quite often when we talk about strategic procurement. Wanjiru, over to you.
Great. Thank you so much, Sanjay. And good morning, good afternoon, everyone. As Sanjay has introduced, my name is Wanjiru Munene. I lead the market access and shipping domain at InSupply Health, which is an East African advisory and consulting firm focused on supply chain, strengthening health systems through supply chain, data use, and other aspects of ensuring that product availability to the last mile. So thanks for that question as well, Sanjay. So just to give a background, and I think why this topic is very important for me, I've worked in regulatory for many years across various multinational pharmaceutical companies and registering products across the region. And one of the key challenges I saw is that we would have the registrations after rigorous interactions with the national medical regulatory authorities, only for the products never to be launched, never to be made available in the region. So this is why this particular topic is important for me, because I think there was an opportunity for us to ensure that there's a business case for these products to be made available, whether it's commercially or through public healthcare programming. And we're going to be discussing the various aspects and facets of ensuring that products are available at costs that are affordable either to the end user here being either the patient, the client, but also governments and other institutions. So just to start by answering your questions, the key concepts when you talk about market assessment and shaping, number one, we have to look at market dynamics. So this is essentially the various interactions between the different actors, as I've mentioned. It could be governments, it could be other private institutions, it could be faith-based organizations, and looking at supply and issues of demand that determine how products are made available. Product services, we call them health product technologies in certain facets. Ensuring that they are, first of all, purchased, they are made available, they are sold, they are also delivered at the service delivery points, and most importantly, they are administered or provided to the clients and the patients who need them the most. So first, market dynamics, and then more specifically now defining market shaping. So these are different interventions or activities that are looking at influencing market dynamics. I've already introduced the aspect of market dynamics. So specifically looking at pharmaceutical supply and demand within a country. So trying to influence, trying to see how we can negotiate, trying to see how we can bring in consolidated orders, or also just relationship. A lot of businesses are also relational, and ensuring that the product is made available for certain markets and it's even allocated in terms of production. When we think about market assessment, I think this is what basically is the anchor of market shaping, because we would need to understand, we need to collect, analyze, interpret data to understand the supply issues, to understand the demand issues, but also to see at what price points can the manufacturers provide the product, at what price points can governments afford that particular product. Again, more importantly, as I said, my background around regulatory, the products will never be made available in any market if they have not met the regulatory requirements in different markets. And then looking at the market dynamics in the context of pharmaceuticals and health product technologies. So those are three key concepts that will form the basics of this discussion this afternoon or morning, depending on where you're dialing in. So why is this particular topic important? And we have to appreciate BizSkilled and SAPICS for making time for this particular discussion, and most especially for Sub-Saharan Africa. We've seen the disruptions that have happened at the beginning of this year when you talk about the USAID, which was the biggest donor across the world. If you think about Kenya, for example, Kenya depends about 25% of their total expenditure on donors. And just to put it in context, there was four main donors, USA being one of them. So our high reliance on donor-funded procurement is really necessitating us to have this conversation on market shaping more importantly, and bringing it to the forefront rather than to the background, which has been the case. And then we have an experience of a fragmented supply landscape. And this also leads to limited competition. So we're buying from different manufacturers, we're buying from different regions, we're buying a whole range of different health products and technologies. So just that fragmentation introduces very difficult situation challenges when it comes to making sure that the products are available to the end user. And then we have variable regulatory frameworks. So if you think about sub-Saharan Africa or Africa in general, we have 54 countries, maybe 55, 56, depending on how we look at them. And, to a great extent, each of these countries has their own regulatory requirements. So it makes it very difficult. It makes it very challenging in terms of diversity of the requirements when I'm a manufacturer. If you think about it, whether I'm a local manufacturer in the region or I'm a global manufacturer, it's very difficult to meet the requirements for each of those countries differently. So one of the things that we'll see is that market shaping also touches on regulatory aspects. High transaction costs, when you think about we are always buying with USD or with foreign currency for this product. So half the time we don't have the Forex available in most of our countries. And then, of course, the fragmented also financial system. We're using different banking. If you think about it, we're using different financial systems to make sure that we have the necessary foreign exchange to buy the products. And then volatility in pricing, supply insecurity. We do know that our region is really featured with very many when you think about either wars or instability in countries, political unrest. A good example is Kenya today. So what does that do to our pricing when you're discussing product availability with different manufacturers or players? Next slide, please. So this particular graph just basically shows you, and as I mentioned earlier, that market shaping cuts across the entire global health continuum, or if you'd like, the product life cycle. So when you think about a product, all the way from ideation to the product being made available to the patient at the service delivery point, we have issues of research and development, which is where we have the drug discovery and development. We'd have to make sure that they support in terms of product development, talk about prices so that you can encourage development and discovery for neglected diseases, especially diseases that are not, quote unquote, considered commercially viable. And then we talk about also priority review voucher when you think about clinical trials and upstream for product availability or product development. So market shaping cuts across, as I mentioned, research development. It would cut across manufacturing. So it's important also for the manufacturers to, for example, get volume guarantees or have volume guarantees agreement. We talk about procurement, pricing information, and also cushioning across the Forex, as I mentioned, as one of the key challenges, and ensuring and committing to ongoing commodity procurement so that even the product is made available to you when you consider about supply plans and availability, especially for global manufacturers. And then when it comes to distribution, we think about channel subsidies. So how do we make sure that the logistics costs are cushioned or the logistics infrastructure is provided? And we have different players who influence the different steps in this particular continuum. And then what is even more important is to make sure that the products are available in our essential medicines list, but also we've trained our providers so that they know how to use those products, they know how to know that the products are available, and to make the necessary data available for forecasting and supply planning. Next slide.
Yeah, Vanjiru, before you move forward, can you also explain what are some of the opportunities for shaping the market in sub-Saharan Africa?
Yeah, so, one of the main example that I would like to use on this slide is we have opportunities for global partnerships when it comes to product manufacturing. So a good example is, a recent example actually is where Unit Aid has brought in a consortium to ensure that there's oxygen availability for the region, as it has partnered with local manufacturers in Kenya and Tanzania, and being supported by implementing partners like Chai and Path to make sure that all the barriers or all the challenges in the system are alleviated, so that you make sure that, in an eventuality like what we saw with COVID, one of our biggest challenges was availability of oxygen in this region. So oxygen would be a very difficult commodity, for example, to be moved across regions or across the globe. So what United has done with different donors coming in to provide the finances and the funding is to bring in different partners to make sure that these manufacturers are well incentivized, they're well motivated to make sure that there's oxygen availability for a region like East Africa. We've had also other partners, for example, AXMED. AXMED is being supported to make sure that they're able to procure globally, but also to incentivize local manufacturers to provide the products in the region. So they're consolidating orders, they're negotiating product availability with different partners, and ensuring that the prices are affordable, they're accessible for clients, but also for the different institutions and organizations. In the next slide. So, why is this topic important, especially when you consider our national procurement agencies? So if you think about East Africa, it would be the KEMSAs, it would be the MSD in Tanzania, and GEMS, for example, in Uganda. So one thing is that we have to be very intentional about creating resilient supply chains, and more importantly, looking at how to address demand and supply barriers. And then secondly, it's to reduce market volatilities or dependencies, especially on the global north, I would say, especially when they come to prioritizing in eventualities of emergencies or pandemics. And we saw very clearly what happened between 2020 and 2022. Why is it also important? We need to accelerate regulatory harmonization. And I think for this one, we have to give a pat on our backs, given that the Africa Medicine Agency has now been completely institutionalized. It has been, we even have a Director General who was just named this month. And we had the first 5 products being reviewed in terms of dossier reviews. And I think this has been a conversation that has been going on for the last 10 to 20 years. So this is a great milestone. It's a great celebration for us as a region. What we saw previously is that we had regional economic blocks coming together for regulatory harmonization. So for example, East Africa community, we had ECOWAS, and we also have the SADC countries coming together to do regulatory harmonization. But as I mentioned, we have 54 countries. And even as we do the regional economic blocks, it's not motivating enough for certain organizations to submit dossiers for product registration and ensuring that they're available for various markets. I think it's also important for us to organize ourselves, as I mentioned, to make sure that the local pharmaceutical industry is also incentivized with different incentives. We talk about energy, capacity building for people to work in those factories, but also a consistent market or an available market for these manufacturers. Next slide, please. So I continue to speak about the opportunities. So it will be very critical, and it's good to see that the conversations have started. We have different partners that are supporting some of these processes when you talk about the different foundations, but also development partners, establishing and enabling policy and regulatory framework. So we have the AMA currently that is now full to go. And then leveraging technology for transparency and efficiency. So how are we purchasing, how are we tracing our products, how we really visualizing the market to understand what are the demand needs so that they can meet the supply needs. And then importantly, it's to scale through regional integration. So here, if you think about the Africa Free Trade Area, how are we able to move products around in the region without so many complexities or many barriers and challenges. Next slide. Yeah, so one of the key challenges, and it should be clear for everyone that currently the sub-Saharan region is importing almost 90% of its health products and technologies from global markets. So think about Asia, some of it coming from Europe, and also from North America and even South America. And this makes it very complex. It makes it fragile in case of any eventualities of emergency. It also makes it very expensive when you think about moving the product, registering the products, and you think about also being allocated production time for this particular region. So what is an opportunity for us when we think about streamlining procurement and financing for the SSA region? One key thing is to boost local and regional manufacturing, and this would strengthen supply chain resilience, especially if we're producing for ourselves. And more importantly, is to produce closer home or closer to the market so that also we are not negotiating for such a long time for product availability, or even when you think about production lines, they are scheduled and secluded for different regions at different times. So if we can sustain this locally, I think this would be very important. And this is also supported by the harmonization when you think about registration. Next slide. So another key thing that could be important for us, even as we consider local and regional manufacturing, is to make sure that the marketplace is very transparent. It's very easy for different players, actors to navigate. There's an opportunity for us to really leverage technology to ensure that we have an efficient way of buying and selling. This also creates competition. It creates efficiencies in terms of planning. It creates also awareness of what is available. So one of the key things that we also recognize is sometimes the product is possibly available, but people are not aware of that information. There's opportunity for us to also facilitate innovative financing. We've seen, for example, a classic case of Kenya where we have M-Pesa being used for innovative financing through MTBA. A lot of this, as I mentioned, is also supported by different actors and partners where clients are able to save or to earmark some funds for their healthcare needs through the M-Pesa platform. And then this also incentivizes the sellers to ensure that they have a market, they have where they can sell, and they're assured of payments. Next slide. Yeah, so that basically introduces us to this particular topic, market shaping. I've really spoken with a high overview, and my colleagues or my panelists will be speaking more on specific examples for the region, but also what is happening at the global arena. So thank you very much, and back to you, Sanjay.
Thank you so much, Vanjiru. That was a great introduction to this webinar, talking about what market shaping is, and how, first of all, why it is really important for sub-Saharan Africa, and what kind of challenges that it can address. Now that we have understood what market shaping is, I would like to invite Ard on the floor, who's the Supply Chain Strategy Director at PFSCM. And I would like him to talk a bit more about assessing the market. So a key question for you is that, as Vanjiru mentioned, different issues related to the sub-Saharan African market, and various strategies that could be employed. But that means that there is a lot of research and a lot of assessment that needs to be done. So from the perspective of a national procurement agency, what are some of the market data which are really crucial for a sound procurement strategy? And then once you answer that, maybe you can also take us through some market assessment strategies that you have also experienced at PFSCM or even beyond. So Ard, over to you.
Thank you, Sanjay. Yes, nice to meet you all. My name is Art van Dongen. I'm a Supply Chain Strategy Director with PFSCM. And PFSCM is a procurement service agent operating for public healthcare. So we, amongst others, work for the Global Fund, but also sometimes directly for ministries of health or NGOs or other organizations active in public healthcare. Your question, Sanjay, about what is critical market data for, I would say, for sound procurement strategy and procurement operations. I think we've just heard a lot about market shaping and really the high level overview. But I think it's really important to know as an organization, if you're a national procurement organization, what you're actually buying currently. So what is your spend? With which suppliers are you buying those products? What products are you buying? What are the characteristics of these products? So that requires a very good insight in actually what you are spending. Well-structured quality spend data, I think, is a starting point for any procurement organization, because then you actually know what you're buying in the first place. Good. Then, from a procurement perspective, I think it's really important to understand your supplier base. And understanding that supplier base is obviously your direct suppliers, so your tier 1 suppliers. But in many markets, it's also important to actually understand your tier 2 and tier 3 suppliers, because sometimes it might look like that you have different suppliers that are competing with each other. But if they're in the end depending on the same, let's say the same raw material or even on the same manufacturer, then that changes the competitive landscape completely. And that also then should inform your procurement strategies for there. Then I think it's really important to know something about what you're actually buying. So know the product, know the characteristics of these products, and know also the markets that these products are being available in. And I think that is really, let's say those 3 things, I would say, answer, let's say, or that's the starting point for, I would say, any good procurement operation. Then 2 other important, I would say, aspects. Sorry, you can. So let's say if you look at the slide, and this is, so it's talking about information about demand. That is really actually knowing your healthcare programs that you support, what you are procuring. And I would actually say that it's also really important to engage your stakeholders in these programs. They're about the demand, what is being expected about demand. There's often situations that ideally we have a forecast, very detailed, but there's also often situations that there is actually not a forecast or not a forecast yet. And also there you do need to procure. So engaging stakeholders, understanding current demand, but also understanding changes in demand is really important. I already spoke about the supply. It's important to know the regulatory and quality aspects of products, and obviously the finance is really critical. What are the budgets that are available? Because in the end, market shaping and procurement is driven by, on one hand, information. You need to know what is required, what is available. Then you need to have the funds available actually to really procure or contract, and then subsequently, let's say, products will become available. So knowing actually what the available budgets are is critical. What I also want to emphasize is that procurement and strategic procurement especially is I would say, a cyclical process that you need to regularly evaluate whether you're on track, where you need to engage with your stakeholders regularly. And I think that is a really important thing, because it's not, you're not going to achieve any strategic objectives if you just do one-off procurements or if you just do transactional procurement. I think it's really important to engage with stakeholders, know what the challenges are and the opportunities they have in their healthcare programs, what are the objectives of these programs, and actually ask the question how procurement can contribute to achieving those objectives. Sometimes it could be that products are not available in the first place. Sometimes it's that they're not affordable. Sometimes that there are supply risks. And all these situations actually require or can require different procurement strategies. So do we need to expand the supplier base? Or do we actually have the right supplier base, but do we want to make sure that that supplier base starts to perform better? So it's really important to know what are the challenges of the healthcare programs, and then develop your procurement strategies to make sure that you contribute to addressing those challenges. Ideally, then you also agree objectives together with those stakeholders to say, okay, that means then that we are going to do this, this, and this, and that should result in a better outcome for your program. So engaging stakeholders, doing that in a cyclical process, and then agreeing on a category strategy, and I will come back to that a little bit later as well, and then defining actionable initiatives for your procurement. And those initiatives can be for the category as a whole, but it can also be very specific initiatives for a certain supplier. If, for instance, if you are dependent on a certain supplier, then you can really start working with that supplier to say, okay, how can we improve performance, for instance, but at the same time have maybe an additional activity to say, okay, how can we get a second supplier or a third one into this specific field? Why I'm emphasizing to do this and not on a, I would say, let's say item by item level, but really as a product category. Because often you will see similarities between products, you will see similarities in certain areas. And in order to make this manageable, it's really helpful to define certain product categories for procurement and develop those strategies at that level, because that makes it a lot more practical, and also allows you to develop strategies that are applicable to a certain segment of products. In the slides, there's one example, and that is actually an example that we have been working on ourselves recently, and that we are currently working on. And that was triggered basically by the threat of antimicrobial resistance. What we did there is that we engaged with a lot of stakeholders that are active in this field, asking what the challenges are, trying to understand what would be required and what we could do from a procurement perspective to support this field. In this case, product availability is often an issue. So what we did is, based on information from a range of stakeholders, developing a dedicated, I would say, portfolio of products with a supplier base specifically for, let's say, this segment for this category. That allowed us to develop that portfolio, to pre-qualify suppliers and products for this, and actually offer that portfolio to public sector clients. So that's a very, I would say, let's say it led by focusing on, in this case, AMR, and focusing on the diagnostics for surveillance and the products for surveillance and diagnostics, allowed us to do something very concrete, developing a product portfolio that we could identify the suppliers, could pre-qualify the products, contract, negotiate. Obviously, that doesn't mean yet that this area is tackled, because we can do this from our perspective. In the end, somebody still needs to have the funds to actually procure. But this is a different way of market shaping. And because I think with the changes in the, let's say, global funding landscape, market shaping traditionally has been or is often a function that, or an activity that is funded globally. There's a donor providing funds, and that is very important, and that is also very helpful. But what if there is not a central pot of money, or if there's no central funds available? Then there have to be other ways of shaping the market. And now, in this case, this is what we can contribute from a procurement perspective to this developing area. And different stakeholders, it's open to everyone. Different stakeholders can contribute to that. So we need to think, or we need to change a little bit, maybe sometimes our thinking about market shaping. One thing is, let's say, kind of externally funded market shaping, but we also should look at what can we do with our own funds by, and I think that's critical, I would say, professional, really good quality and strategic procurement, because I think that having strategic procurement capacity in-house in, for instance, a Ministry of Health or in other procuring organizations is really critical to get the most value out of the budgets that you do have available. I hope that answers your question, Sanjay.
Yeah, indeed. Art, would you also like to explain a bit more on the category strategy that you said you will? So I'm just
Yeah.
pulling back on those slides. So maybe in the last 3 minutes that you have, maybe you can quickly explain what you meant by that.
Yeah. Okay. So we within PFSCM, we apply a category strategy approach. That means that we let's say, segment everything we procure, but also things that we do not procure yet, but that we think that there is a need or there's an opportunity to support the public sector with our services, that we, let's say, define that in categories. We try to then subsequently understand the dynamics in that category. So if you take an example of AMR, what type of products are required? Who are the suppliers that are critical for this category? So we get a good picture of that category. Then we engage with stakeholders that actually are in need of products in order to deliver on their program objectives. And I think it's important to know that, because as a procurement agency, if you are, and also a national procurement agency, if you are involved in early on, actually in program, let's say maybe design, if you understand the program objectives and the priorities within a program, whether it's an AMR program or a malaria program or just public healthcare, then actually you can start thinking strategically about, okay, what can we do to support this, let's say, this program, and to get the biggest, I would say, value out of the funds that are available. So that's, let's say, the business requirements. From that, we then agree basically objectives with our clients to say, okay, that means that for that program, you would like to see expansion of the supplier base, or we would like to achieve a reduction in cost, or we would like to eliminate supply chain disruptions, or we would like to shorten lead times, or maybe all of them, all of the above at the same time. But it's critical that you, let's say, have the same understanding, and that it's then clear what you can work on, and then you can subsequently take initiatives to deliver on that. And that could be that you say, okay, we have to do a competitive tender. But it could also be to say, no, we need to actually change the contracting terms with a certain supplier, or we need to change the delivery models, or we would like to automate so that it becomes much faster and efficient. But by going through this, let's say, category strategy methodology in a structured manner, you arrive at actionable initiatives that you can take that are then also, of course, going to deliver on the objectives. And within this methodology, we incorporate basically all kind of best procurement practices, which can range from cost analysis of what is the actual cost structure of a product. It involves what I just said in the beginning, analyzing, okay, but what is the structure of this market? It looks like that it's competitive, but maybe they're all dependent on the same API. Then we really do need to know something about that API market as well in order to come with a good strategy. So we incorporate, I would say, all best procurement practices that you would learn at university about if you study procurement and supply chain management, and those are part of this, let's say, this cycle, and are part of the analysis that we do to get from a category via business requirements to strategic objectives. So that's something that we do, and it has been, let's say, we have been very happy with following that structured methodology as an organization. So I would recommend any procurement organization to think about that and to incorporate those type of processes.
Excellent. Thank you so much, Ard. I think this was a great, next stage to understand what kind of data sets that are available that needs to be looked at, and how different strategies needs to be employed in order to make procurement more strategic and with the long-term purview. Now, linking it, linking to what Ard has said in the last 15 minutes, I would like to invite Katrina Tyson, who's the supply chain practice lead at Health for Development, and has a lot of experience from a private sector perspective, that, what are some of these, of course, to answer what are some of these, market shaping practices or strategies that can be applied at a national level. So we will start with that, and then Katrina, I will ask you another question, in between your talk. So over to you, Katrina.
Thank you. So thank you everyone for giving me some of your time. I have spent most of my life working in private sector in the pharmaceutical industry. I've been working more in the development sector and with the public sector in Africa in the past 5 years. And I think for a long time, I understood market shaping to be about pooled procurement. And now I understand it to be much broader. And I like to think about market shaping as a toolbox with many tools in it. And what's important is that when we think about market shaping, we understand what's the problem that we're trying to solve, and what's the specific root cause of that problem, and how can we try to tackle that root cause. And I think that it's helped me to understand that if a market is not shaped for us, it will work against us. And I think many of the previous speakers have mentioned the impact the pandemic had. And while it was a catastrophic health event, it did give us all an insight into some of the challenges that the populations across many low and middle income countries experience. So the reality of being in long queues, no guarantee that the medicines or vaccines that we needed will be available. And so a lot of the solutions we're talking about how we cultivate that landscape to be local, more resilient, and financially self-sustaining. So I'm going to talk about 3 areas today. I think each of these different topics has the ability to fill up a webinar in its own. So I'll touch on some of them, and we can always go through some of them more in the questions. And I wanted to think a little bit more about how we shape the supply side for local manufacturing. And so how do we accelerate local manufacturing of health commodities in Africa? As we've heard, between 5 and 25% of the medicines that are used in Africa are made in Africa. So it's very low, and right towards the lower end if we consider the full manufacturing process and not just packing. So why do we care about this? Isn't it best that we just have the lowest price medicines? Does it matter where they are actually manufactured? Or that'll touch on my next point, but having locally manufactured products gives African healthcare needs the opportunity for their specific requirements to be manufactured. There are many products, many essential medicines that African governments struggle to access from the existing supply base. And then the second really important component of localized manufacturing or regional manufacturing is resilience to supply chain shocks and pandemics. So I'm going to talk a little bit about some of the interventions that enable local manufacturing to give us a more proactive preparation for pandemics. If we create solutions that just focus on a unit price, we're going to see a repeat of some of the issues we did experience during COVID, where Africa was not first in the queue when demand exceeded supply, and when global supply chains were disrupted, the majority of our supply base was far away. And so creating solutions that capacitate African manufacturers of medicines will try to address that vulnerability we have to external shocks. And then the third part that we'll talk a little bit about today is the importance of having sustainable finance mechanisms. So we think about market interventions, market shaping, and we often think about how do we do the pool procurement? How do we aggregate the demand? How do we utilize solutions to give better visibility? But the sustainable finance mechanisms are not a nice to have add-on. They are a core component of market shaping interventions. And as some of the previous speakers have highlighted, we've moved out of a world where a big chunk of the funding for health commodities came from the US government. So having that significant portion of financial resources from external donor sources. And so we need to start thinking through what some of those finance mechanisms are when the finance repayment is coming from individual businesses or governments, which have different needs and different risk profiles. So we'll talk about those as well. If we could go to the next slide. Thank you. So if we focus specifically on accelerating local manufacturing in Africa, as we said, there's many tools in the market shaping toolbox. So what are some of the root causes for the low volume of medicines being manufactured in the continent? And there are a number of different root causes. There are, if we look from a demand side, what pharmaceutical demand is complex. It's driven by demand for quality assured but often low priced medicines. And a lot of the consolidation of the current supply base is in 2 countries, in India and China. If we look into the private market, it is fragmented and often unorganized, even though it does represent a large proportion of the spending in most of the countries in the lower middle income grouping. And then if we look at the government procurement, while their volumes are significant, it's often complex, and the ability or the reliability to pay is a challenge for small manufacturers. And then if we look at donors, they often require third-party regulatory approvals. They do require the lowest pricing, and they want to secure ultra large infrequent orders. So a lot of these things make it tricky for small local manufacturers to be able to access a market. And then if we look at it from a supply side, as I said, many Indian and Chinese generic companies, they sell large volumes of products, and they've had decades of investment into optimizing their manufacturing processes so they can achieve the best prices, and they have high volumes with which to spread their costs. And it's very tricky for some of the smaller manufacturers in Africa to compete. So they've had 20 years of licensing, tech transfer processes, incentives from donors, and many of them have benefited from tax incentives from their own governments that have given them the opportunity to be able to achieve these low prices. And so we need to think about how we can support African suppliers in the same way. And that doesn't mean that we need 100% of the medicines that are sold in the continent to be made on the continent, but identifying where those solutions make sense. And it's not just for factories to be competitive and high quality, but it's also thinking about how these factories can then manufacture and even start to do the research and development into products that are specific for African healthcare needs. So we focus on these three levers that we've got on the screen in front of us. I think you've heard from a colleague about some of the benefits of large volume procurement. So what's the benefit from demand aggregation through pool procurement and having volume guarantees for a manufacturer? So this says to someone, if I do make it, will someone buy it? So remember that manufacturers are businesses. They need to know that what they make, they can do profitably. And the profitability of products does increase with volume. So where you have fixed costs that can be spread over a greater volume that's manufactured, that gives the ability for manufacturers to make more profit up to a plateau. And so they want to know, if I do make it, will someone buy it? And then the second piece, which we had also mentioned, a lot of news about the AMA in recent weeks, is regulatory harmonization. So what does this mean for a manufacturer? It's, if I make these products, can I sell it across borders without getting stuck in red tape for many years? Can I access a bigger market? And many of the manufacturers in Africa, they predominantly focus on domestic supply. That limits the profitability of their business. And then the last one here is about advanced market commitments. So what's the concept here for a manufacturer? Well, this one is saying, if you invest in the research and development to create this product and it gets approved, we're going to guarantee a viable market for you. So the manufacturers need to know if they make investments that someone's going to buy it, that they have opportunities to access markets, and that if they are making the big investments to create products that are going to be suitable for an African continent, that there will be a market for them to access, because these activities take a lot of time. So volume guarantee, this is a contractual promise from a buyer or a group of buyers to purchase a certain quantity of a product over a period. It's a really powerful demand signal for products that may already exist, but they may not have a stable or a predictable market. So if you do produce it at the right price and quality, we're going to buy this much. And I think the African Medicines Agency is one of the most single important market shaping tools we have in this region. And we've seen the value that can be achieved by regional harmonization from Europe, which started in the 1990s. So this can reduce complexity, reduce time, It means that a manufacturer can submit one time versus multiple times through multiple countries, which is costly and complex. And the time to get to the approval should be reduced. We're hoping get from 5 years down to 1 year. And all of these things combined then can de-risk investments. It provides some certainty either to the investors in the manufacturers, that helps answers the manufacturer's question of where that market will be if they make the investment. So I think some key takeaways, there's some big barriers for manufacturers on the continent, and to accelerate manufacturing, we can use tools that will help create more demand aggregation, create more unification in the market, and also unification in terms of regulatory harmonization to simplify the ability to access more markets. So we need to shift our procurement mindset from not just buying the cheapest unit price product today to actually investing in that sustainable capacity that will produce the products that we want in Africa tomorrow. I think you can go to the next slide, please. All of these concepts are very much interlinked. We've all lived through a pandemic, and one could argue that antimicrobial resistance is a pandemic, silent pandemic that's ongoing all the time. But we learnt from the pandemic that our supply chains are long. If you look at the time frame to produce some of the raw materials, the active pharmaceutical ingredients, the movement between primary and secondary factories, and then movement to the end country. Some supply chains for medicines are as long as 2 years. So the API manufacturers are forecasting the requirements a long time before that product is dispensed to a patient. So within Africa, we are succumbing to the decisions that are made thousands of kilometers away, and we may be at the back of the line. And so during health emergencies, pandemics, supply chain disruptions, and natural disasters, having a limited capacity for our own medicines production, that limits our ability to respond quickly. And it does make us more impacted from disruptions that happen in the global supply chain. So that also can increase costs, delays, and stockouts. So having regional solutions with procurement strategies that prioritize resilience as well as cost enable us to have more resilience in the face of some of these shocks. So I've got a few different suggestions here. There are many different procurement strategies that can be considered, but having differentiated approaches to where you look for pool procurement, what you look to buy through a pool procurement mechanism, having different strategies for your products. There's no one size fits all, and considering how you can build some resilience into your procurement strategies. And all of these things are aiming to reduce your risk. So if disruption hits one part of the world, having a regional hub in Africa, it may then still be operational. It will look to increase speed and agility. So again, in a pandemic or during a supply chain disruption, having a hub that is a few hours away versus a few weeks away can create the ability for a more agile response. And having better transparency and collaboration. So sometimes that's just as simple as working with suppliers on your own time zones, or working with stockholding in regional locations and having strong partnerships for collaboration where you are willing to share information in a transparent manner. I think the key thing when thinking through some of the strategies here is that one size doesn't fit all. What works for a particular category of product or a specific type of product may not work for every product. And we've seen that the Africa CDC pool procurement mechanism is looking to focus on products which make sense to pool procurement and a continental perspective, and there are some other products that make more sense to be pooled regionally. So aligning some of the disease and health needs within the region and having stock holding in regional locations, and considering where it makes sense to have stock in your own country. I guess the other thing on the slide here, if we're thinking about spreading the risk geographically, we went through a period in previous decades where we looked to offshore production to lower cost locations. I think a phrase that's used now is nearshoring. So can we have a combination of sources of our most important products that are balancing that risk? So having relocating some of our sourcing into the continent, but balancing that with supply from other places just to mitigate risk. So I think just to summarize on that slide, in terms of a key takeaway, that we need to build resilience into our procurement strategies that enable and consider the impact of pandemic and supply chain shocks. And we won't do that if we just focus on unit price. And we need to think about what that continuity could look like by incorporating some of the flexibility and agility that can come from regional solutions. Okay, and then I think the last area we'll focus today is on sustainable financing mechanisms and how they can enable regional manufacturing. So if you think from a supplier side, so think we're one of our African manufacturers, let's say it's a manufacturer in Kenya, and they've been awarded a large pool procurement contract to supply a number of neighbouring countries. So it's great success for them. The order is 100 million, but to do that, they need 40 million upfront. That's to pay for the active pharmaceutical ingredients, to pay for the labour, the electricity. So they produce and ship those goods, and then adding on to that, the payment terms for some government buyers can go into many, many days. That they've won this wonderful contract, but they're not going to see any revenue on that contract for many, many months. So they have no cash to get started, and they have a long time frame once they've done the production before they'll get paid. And this is just one of the areas where having some strategic and differentiated financing mechanisms is going to be really important for African manufacturers. So having a working capital mechanism that enables manufacturers to be able to get started, to produce, and then to start to cover that period of time while they're waiting for payment. And credit's often described as the lifeblood of medicine's route to market, particularly in the private sector. And I think that often decisions are made on procurement based on where there are open credit lines, particularly when we start to look at wholesalers and distributors. So again, it just reiterates the point that incorporating consideration of sustainable financing mechanisms as part of market shaping interventions is super important and a key enabler for that sustainability. So I've put another one on here, blended finance. This is a phrase, again, that we hear a lot. What does that actually mean? It's a phrase that just relates to combining a strategic use of different source of funds and capital, starting often with public or philanthropic capital that can then be mobilized and enable private sector investments to come in and de-risk their investments for sustainable development. It helps to create some certainty. So, for example, partnering different market shaping interventions is really important. So getting investments into African manufacturers that will enable them to either procure the materials they need to get started or even invest in capital investment to do the manufacturing is going to be de-risked by having things like a volume guarantee. So that de-risks the investment that the different financial institutions can make. Another one that we have on this slide, and we've seen some different countries and organizations making use of a revolving fund. So what is a revolving fund? So again, this is also a self-sustaining financial mechanism in theory. So you can think of it as a dedicated pot of money that replenishes itself. So it requires an initial capital to be established. So that's often called the seed capital, and that can come from government, a donor, or like from the members within the purchasing group. And the expenditures, then that money is used to purchase the goods, in this case, medicines. And then when the goods are provided to users, they pay a fee. So that money is then returned back to the revolving fund and replenished. And the idea is that fund then is a closed loop system, which in theory could operate indefinitely without needing new capital injections if it's managed properly. And there's a revolving fund in operation or about to be operational within Nigeria, and this is also a mechanism that was used by PAHO for their pool procurement. So I guess on this piece, financing and sustainable financing is a core component of market shaping. It doesn't have to be a donation, it's an investment. And I think our role in considering some of these market shaping interventions is to think about the requirement to finance some of the interventions that will enable African manufacturers to start taking a bigger role. Okay, I think next slide.
Katrina, I'm sorry, I will have to move very quickly to
Yeah,
the
I understand.
other speaker. I know there is one very important slide which is left, but probably maybe during the Q&A session, maybe you talk about it briefly about some of the prerequisites for market shaping as well. And anyways, we will be sharing these slides as well. But anyways, I think you took time to talk about some of the strategies, which was very crucial because market shaping strategies sometimes can look confusing because they may also sound like financing, procurement, or something else. So, why do we call them market shaping? So it was good that you explained how all these together can be considered or they come under the gamut of market shaping. So thank you so much, Katrina. I would like to invite our next speaker, Lydia Ashieng from Africa Resource Center. She's the Senior Program Manager on Market Access or Market Shaping issues based in Kenya. Linda. Yes, sorry, Linda. I've been working with 5 different people with very similar names, so apologies in advance. So, Linda, I would like you to focus a bit more on sub-Saharan Africa and talk about some of the market shaping challenges. Now that we have heard from the previous experts what market shaping is, what kind of market data is needed, what kind of strategies can be employed. And I see some of the questions that are coming to us. They're talking about some challenges already. So I would request if you can talk a bit more about what challenges have you seen at a country level, at at a national procurement agency level, and what kind of solutions can they employ to address those challenges. So Linda, over to you.
Thank you, Sajay. Good morning, good afternoon to everyone on the call. Thank you for giving me your time. So Africa Resource Center is an African-based institution that works to strengthen public health supply chain systems. And we do this by placing expert advisory services, we call them enablers, with national ministries of health. For this session, I'm going to reflect on our work in Kenya, focusing on our experience in working with the Ministry of Health through the Directorate of Health Products and Technologies to strengthen, to initiate market shaping interventions, and also in our response to various donor requests around market shaping. So to your question, Sanjay, about some of the challenges we have sort of experienced or interacted with throughout our work, specifically over the last 3 years. One of them is fragmented and product-specific initiatives. As the previous speakers have said, most of the market shaping interventions are often donor-driven. And because of this donor-focused kind of funding, you'd find that the scope of these interventions are often limited. And because they come with a limited fiscal legroom, they often don't have a lot of room to look at the system as a whole. So they'd be focusing on that project, that product alone. And so because of these limited resources, they are often strained in strengthening national market shaping mechanisms, and often just focus on what they're funded to do for that period of time. So the second challenge, Sanjay, the next slide. The second challenge that ties in with the fragmented donor priorities, it often leads to fragmented and in some cases market unavailability of market data. Because of this fragmentation, we know it's fragmented at the lower levels, but we know that some kind of aggregation happens prior to submission of this data to the donors. But what we don't see the capacity building of national institutions. We don't see the data sharing with these partners, with the national institutions. And what this does, it creates a capacity gap. So our institutions most of the time do not have the right capacity to collect the data, to analyze the data, and to use this data for their own decision making. And because of this lack of institutionalized capacity, often we have a lot of siloed approaches to market shaping, and it plays against what Katrina mentioned about market shaping is a toolbox. So if you only focus on one tool, then the system does not work for the general good of the public. And because of the conflicting priorities among stakeholders, we have observed that there's a lot of trust barriers that comes into play, and this hinders collective or individual efforts that aim to address market failures. Challenge number 3 that we see, and I think Dr. Wanjiru spoke about this, is the weak and variable regulatory and quality assurance frameworks. We all understand what the role of a strong regulatory framework could play in our setting. It would attract a lot of investments. It would promote a lot of confidence in what you're producing as a country or as a continent, and many investors would want to come and do business on our continent, and would promote a lot, help us address most of the access affordability issues we have around HVT. But on the continent, only 8 national regulatory agencies have achieved maturity level 3. And so this, as you can tell, we are still far much behind. And even among the 8, one of the challenges that we're observing is there's no regulatory reliance among these 8 agencies. And so what we are hoping that now that AMA is well institutionalized, there's a CEO, there's a director, we are hoping to see a lot of these 8 agencies working together, relying on one another to register and sort of give confidence among themselves on how to approach regulatory issues, and probably trust themselves as well. And so we know that once this is done, we're going to bring in a lot of stakeholder confidence. We're going to attract a lot of investments in local manufacturing, and we are going to create a rich ground to scale up production of our of HVT products. And so moving on to what we see as potential solutions or potential ways of addressing this. The previous speaker, Katrina, has spoken a bit to some of them, but looking at this from a system point of view, Sanjay, next slide, please. We see we propose that there's a need for a holistic market and evidence-informed approach to market shaping. And we say this because there's a general lack of local capacity. There's a general lack of ownership of the data, of the market dynamics, data supply side, demand side, that can be used to inform solutions. And because of this capability gap, we have observed that we are not able to look at our market holistically from the demand side, the supply side, what are the financing issues, and how can we collectively as an institution, as a country, work together to address these solutions. So we believe that we need to build local capacity. We need to look at our market as a whole, not fragment it further, even though most of this fragmentation, as you've seen, is donor informed, but it calls for a lot of country and government ownership. It speaks to financing, which, as we know now, our sector is really struggling. But then we need to ensure that this is done to address access issues across the supply chain value chain. Secondly, we believe that going forward, all our interventions, all our initiatives needs to be collaborative. We need to work together. There's no one shoe fits all, but we need to bring ourselves to the same table. We need to utilize our data to catalyze action. And when you speak of data, think of the demand side data, think of the supply chain side data. We also need to rely, the public and the private sector need to synergize. The market failures identified from the public side, the market failures identified from the private sector side. There should be some kind of trust in, addressing and synergizing this data to inform interventions towards addressing some of the market failures. And we believe in data sharing. So there should be platforms at the national level, platforms at the regional level, ESC level, for example, or platforms at the country, at the Africa-wide level that allows for collaboration. They exist, but they need to be strengthened. That allows for data sharing in a way that it's open and it's trustworthy, and everyone sort of works to addressing specific or collective market failures. And thirdly, to close on this, regulatory harmonization. Dr. Wanjiru spoke about this. We have the 8. We'd want to see a demonstration of trust among the 8 regulatory agencies. Can they start working together? Can they demonstrate some level of trust? And the 8 that have already achieved their harmonization status, can they share their reports with countries that are working towards that? What should you look out for? How can you address some of the assessment questions as you work towards achieving your regulatory status? Thank you so much, Sanjay, and back to you. Thank you.
Thank you. Thank you so much, Linda. And thank you for catching up with the time as well. You were very efficient, not to say the others won't. This was a great, segment where we formally heard about some of the challenges that countries are facing when it comes to shaping the pharmaceutical and the medical products market. Linking it with the next section, I would like to invite Jan Komska, who is the contracts manager at UNICEF Supply Division, and he has been looking at large procurements in the last 2 decades. And with UNICEF, he has looked at buying different types of products. So Jan, welcome. I would like to ask you more specifically about some of these strategies, some of the procurement approaches that you have seen over the years with UNICEF, how those strategies have helped shape the market in some of the program areas or for the products that UNICEF have purchased, and how some of those strategies can be employed at a national level, linking it with what other experts have talked about. So, Jean, over to you.
Yes. Thank you, and thank you everyone for good preparation for what I will be talking about. And so I would like to, of course, catch up a little bit. So UNICEF is a major buyer of in humanitarian space, and yeah, I will go next one. And we have procured more than 5.6 billion worth of goods and services last year. What is important, as some of my fellow speakers were talking about, is that it is important to stay focused, not to be fragmented, and therefore each of the organization or the governments or even private companies should have some organizational priorities where we can link then the items that we are buying are in support of this. So, for example, for us, we are buying products that support Sustainable Development Goal, our internal strategic plan, children's rights, or core commitments for children in humanitarian emergencies as a company or as an organization that supports or responds to emergencies. You can imagine that when there is an emergency, that is not the time when we are doing market shaping. There is a long process that we have in place and where we are preparing ourselves to be able to react and to respond to emergency during which we do these market shaping activities. We have also our policies that are enabling us to develop markets. We have one of the policies that we should be sourcing as much as possible items locally, or for products where there might be some issues with the quality, complexity, like vaccines or pharmaceuticals, we have centralized their procurement. And then we have also our internal procedures, and one of the procedures says or pushes us that any procurement that is of value more than $5 million per year, we have to have written procurement strategy. And part of that written procurement strategy, we have to reflect what are our suppliers, what are their weaknesses, what are the product characteristics, are there possibility to do some improvements, and how can we better serve our end users, customers, in our case, children in countries sub-Saharan Africa, for example. I also would like to touch base a little bit on sustainable procurement, because sometimes it is its view is a little bit limited only to, okay, is the product made of plastic? Then it is bad, we should not be buying it. Whereas in UNICEF, we have looked into it more holistically. And when we are talking about sustainable procurement, we are looking at three different pillars: environmental pillars, social pillar, and economic pillar. And we are asking ourselves how these three pillars are integrated in all procurement process that is here on this slide outlined on the bottom, where we start already from the definition of the needs until all the way to the end, where we ask end users how they use the product and are there any improvements that they would like us to make. So definitely we want to look at the environmental risks, but also social risks and economic elements when we are doing our procurement. Next slide. And then specifically, can you go to the next, please? And then specifically, what are the products that we are identifying and where an effort needs to be spent on, yes, the next one, when we are performing market shaping activities. And somebody already was mentioning that before, and so I'm happy that we are not very much off in this. This would be the products in our case where they are not available or availability is limited. For example, production capacity is not sufficient to cover our demand. This can typically happen when we are introducing new intervention and we are rolling it out, but we have not properly discussed between supply section, our program section, and suddenly there is a huge demand for product, but we have not yet developed the market. It can be also when we have problems with quality. Product is already on the market, but we are receiving frequent complaints, or we have detected that the supplier is not meeting the requirements that we set in product specification. Or it can be linked to the product affordability. The price is extremely high, and then we feel that we need to do something about that. And then also, and this was not mentioned before, when the level of product innovation is not sufficient. And for us, it is very important in UNICEF that, yes, maybe there are products that are suitable for adults, but they are not suitable for children, and specifically not suitable for disabled children. And so this would be the consideration when we are thinking on which of the products should we focus our attention. So first, we have developed our procurement strategy. We have identified the products that are more costly. We look at all these three different pillars in terms of how sustainable is the procurement and what impact these products have on the future of the planet. And then we look which of the major challenges these products have, as highlighted here. And I'm coming to the end. I have only 2 more slides, where I would like to share with you my personal experience with 2 different products that I was involved with. So the next slide. So the first one is a nutrition product. It is peanut-based product with full of micronutrients that is used for severely malnourished children. This is not a product that you can buy in a supermarket. This is a product that was specifically designed for this particular group of children. When we started, it was nearly 20 million children in the world that needed this product in order for them to be saved for certain death. And when we piloted the intervention, when we have sufficient proof that product is efficient, we suddenly realized, and that the demand started to grow, we suddenly realized that we have only one supplier. They were located in Europe, and they were unable to cope with increased demand. The product characteristic itself, that it was quite a heavy product, prevented us, or we tried to avoid to send this product by air from Europe to Africa, and therefore we clearly needed that an intervention needs to be made on the market, knowing that the product did not require any specific manufacturing or complicated manufacturing process. However, it required quite a strict quality requirement in terms of how the product is manufactured and of the composition of the product. And so then there were certain steps and then interventions that we have made, although they are listed here in this bubble as a small bullet points. Behind each of these interventions, there was a huge effort and team that work on these interventions. So we're looking at the potential manufacturers. Are there any food manufacturers that might have some experience manufacturing similar products? Then we were working on knowledge transfer, while maintaining product quality, training regularly the few companies that we have identified as potential via regular inspections. Somebody mentioned here already about advanced commitment, placing small initial orders, offering reduced payment terms, and then continuously monitoring supplier performance, not only whether they are delivering good quality product, but whether also their financial health remains stable so that we can rely on them. And so in case of placing orders, that we can be sure that we will get the product that is needed. And so, and this was a very long process. We started sometimes in 2006, and now we are in 2025, so nearly 20 years later, where we moved from one single European supplier to about 21 suppliers last year, where 9 of them are located in Africa, and they were able to deliver 60% of our total UNICEF needs. So this is a really example of success story, but success story that require a lot of energy, time consuming, a long time, but clearly paid off. The next one. So right now I am focusing on the vaccine storage. So our objective as a UNICEF is to vaccinate maximum of children.
However, vaccines have a specific characteristic that they have to be stored 2 to 8 degrees, so it means they need refrigeration. In order to have a refrigerator, you need to have source of energy, electricity, and this is very challenging in many areas where children live far away from the urban areas where there is, of course, electricity grid. So therefore, we have a product, solar-powered refrigerator. Also, first time, sometimes 15, 20 years ago, where it came to be. However, it is very costly, and we have also had market dominance. We knew that product containing many components requiring skilled manufacturing process, it would be difficult to identify sources in Africa, for example. And therefore, we went to the supplier. So in order to reduce the price, so here the objective was a little bit different. Here it was not the objective as in previous example where we were trying to bring the manufacturers or identify manufacturers in Africa so that we can transport this heavy product through rather than by air on the road in Africa. Here we were needing to reduce the market dominance and reduce the price of the product by increasing competition, but from the global players. So manufacturers that potentially manufacture domestic fridges and would be willing to also entertain this type of innovative product, solar-powered refrigerators. And again, we went through these small bullet points, but behind them, each of them is a lot of effort that was put in place. And we were shaping the market by helping new suppliers that express interest and invested in developing the product, proving that the product is efficient, giving them allocations. And slowly reducing the market dominance with one manufacturer. After now a recent 5 years of effort, we have reduced the market dominance and so that the dominant supplier has lower than 40% of the market share. So more suppliers came online, and we are able to then compete or improve competition on the market, reduce price, and offer countries options so that we don't depend only one manufacturer. And this was extremely beneficial during COVID, where the demand for refrigerators for vaccines because of the COVID vaccine has dramatically increased. And we were able to, despite the disruption in the global supply chain, we were able to satisfy the needs from multiple sources which we developed prior. Thank you. That would be all from me.
Thank you so much, Jan. Really great case examples on how as an organization there is a need to work with multiple suppliers in creating and developing markets of products which may not exist. Sometimes markets do exist in certain places which can be very hard to procure from, and these case examples can also serve as a benchmark on how to develop market for yourself. So thank you so much, Jan, for bringing the experience of UNICEF from over the years. I would now invite all the panelists to switch on their cameras and come to the floor for the Q&A. We have a lot of questions which have been asked. I have already answered some of them, and I have tried to sieve through some of the questions already. There are two questions which I think Katrina, you're still there? I guess. Okay, maybe I'm not able to see. Yeah, okay, excellent. So there are two questions, Katrina, I think on taxes and for manufacturers, which I think should be a great fit for you if you think. Maybe you want to read them. So one is from Daniel Ngubu and one is from Kihembo Edith. So first question is what are the existing strategies taken by manufacturers or suppliers overseas to mitigate market handles, such as tax requirements, tax man or tax requirements? The second question is, how can a manufacturing plant be helped regionally when it comes to taxes and charges incurred during importation of products? So if you think you can answer both of them, because I think both of them are related to taxes and how some preferences can be given.
Sure. I'll try and do it quickly so we can go through some other questions, but happy to follow up with Daniel directly afterwards if you're going to be sharing contact details. So one of the initiatives I'm involved in is AMTEC, which is African Healthcare Manufacturing Trade Conference and Exhibition, specifically looking to tackle some of the challenges facing African manufacturers. And I think there are a couple of different ways that governments can help support African manufacturers, but often that requires some advocacy to help governments in terms of putting some of these policies and practices in place. So on the one hand, in terms of purchasing, there is looking at incentives for local manufacturers, so whereby they get purchase price preference in tenders, and that can mean that their prices get a balancing percentage. And then the other one can be looking at some of the taxes and duties that are applied to make it more of a level playing field for African manufacturers. So in some cases that can be putting higher import duties and taxes on products that come from overseas when the medicines can be manufactured in the country themselves, and we've seen that happen in a few countries, namely Nigeria. The other thing, in some countries we've seen, like Bangladesh and Indonesia, they have complete import bans for products that can be manufactured in the country. This can obviously have a negative effect on resilience, but it does then help establish the investment in local manufacturing. And then I think there's some advocacy to be done in many countries to try and balance out where the taxes and duties are charged, because sometimes there are high taxes and duties on some of the raw materials and then lower taxes and duties on products that are imported, which makes it a very challenging environment for local manufacturers to compete in. And that requires some advocacy at a government level in terms of trade, finance, in collaboration with health. And one of the things that we're doing through AMTEC and through the Federation of African Medicines Manufacturers, which represents over 600 members on the continent, is trying to create these key advocacy messages to help governments in setting their strategy.
Thank you. Thank you so much, Katrina. I hope it answers both of your questions, Daniel and Edith. I would like to ask the next question to you, Ard. I mean, it has also come specifically on your name. I will not read the entire thing, but Enos Goba is asking that I would be interested in hearing about mechanisms to fight substandard or adulterated or falsified products which are flooding the market and not easily detectable. I think it also goes well with your segment where you talked about AMR as a challenge and how you at PFSCM address those issues. I think for any and all procurement agencies, having to fight substandard or falsified products is a big issue. So maybe you can shed some more light on that, Ard.
Yeah, I think there's two angles to that. I think first of all is the strengthening of regulatory authorities and of pharmaceutical and medical devices markets. I think that's the first step. That only products are allowed on the market that actually meet the requirements, etc. Then, as a procurement agency, I think you have an additional responsibility to really know your suppliers and pre-qualify the suppliers, know what the manufacturing capabilities of these suppliers are, the quality control systems they have in place, the quality management systems they have, and you have to make that part of your pre-qualification process with a supplier. And the same you can also do with products. Obviously, you need to find a balance. You you shouldn't repeat what the regulatory authorities is doing, because that's the regulatory authorities' responsibility. But as an organization that is procuring, it's really critical that you pre-qualify your suppliers, pre-qualify your products, and monitor what's happening with those products, whether there's complaints or whether there's issues identified. And in that way, you can keep substandard products out of the market. But it requires, I think, also often longer-term relationships with suppliers than a one-off procurement. You do a tender and you see who responds, and that's where you buy. I would really advocate for longer-term supplier relations, clear engagement with suppliers, jointly working with suppliers, working in partnership, and making sure that you get the best value out of that.
Thank you so much, Ard. There are some questions which are very similar. So I'm going to read them, and maybe one of you can answer it. I mean, I think all of you have similar experience in this area. So, I mean, any one of you can answer it as you wish. So first is from Edrek. He talks about that price is an important element determining competitiveness. Even if pool procurement and volume guarantees will succeed, it is not assured that prices will be competitive with prices of products manufactured in India. Should that be addressed through monetary or non-monetary tariffs? Then a similar question is from Hasibul Haq, who talks about that for countries with small domestic markets, government is a major buyer using a winner-takes-all tendering process. How can you balance domestic manufacturing with that kind of competitiveness? Because there is a chance that if they don't win a tender, they might be out of market. Similarly, Ram Kaji Bhumi is asking about how to check about the market standing of a manufacturer. I think this was talked about by Jean. It was also talked about by Katrina, I believe. So he's asking how do you check that they are of good standing with respect to financial, regulatory, production, quality, all that. So I think these are very similar questions with respect to prices, competitiveness, and standing of understanding the market standing of a manufacturer. So anyone who would like to respond to this?
I'm happy to go in with I think the first question, and apologies if I didn't quite catch it all. There was a lot of information in those questions. Like balancing out the pricing piece between manufacturers that are just getting started versus some of the like Indian Chinese manufacturers obviously benefited from decades of investment and pricing control. Like should that be handled by tariffs, I think was one of the questions. So I think that there are a couple of different ways to look at this. And again, there's no one size fits all. I think sometimes if you only look at unit price, it gives you a proportion of the calculation. I think it's good to look at the total cost to serve. So what's the cost and the complexity of the logistics cost of moving between countries and what are the lead times and what does that mean in terms of responsiveness? I think that tariffs are one tool, one lever that can be leveraged. And I think that they support the investment in local manufacturing as well as being able to leverage some of the cost benefits. I think one of the other tools that governments have in their toolbox is the ability to be able to recognize that they're willing to pay slightly more for local manufactured products through tender processes, so giving them price preference, which again gives them in return some of the resilience if that capacity then can be maintained locally. And I think that the use of tariffs either on raw materials or on finished goods to support lower importation for products that are manufactured locally is definitely one that is deployed across many countries across the world. I think once we're in a different situation, like within the European Union, where they don't tend to take that approach, it's because there is already a very strong and established pharmaceutical network across many countries. And they're often at the front of the line when it comes to supply disruptions. I think African governments have to take a slightly different approach because they are often last in the queue, and therefore should employ an element of protectionism without compromising on some of the resilience they would want for certain product portfolios.
Thank you, Katrina. There are multiple questions asked by two of the attendees, Enos Goba and Frederick Efige. I think I would like to put one of the questions for either Linda or Vanjiru because they are more from the perspective of Africa. So the question is that how can African countries leverage pool procurement or regional harmonization to increase demand certainty and incentivize local production? And similarly, he's also asking, in what ways can African stakeholders influence global donor procurement policies to favor local sourcing? I think they are very related.
Thank you, Sanjay, for that question. I'll speak from the Kenyan experience. So Kenya has a preferential procurement list that targets HVT products that are locally manufactured. And so this list is reviewed every couple of years just to ensure that it's still applicable. And the list is what our KEMSA would use for procurement of to give priority to local manufacturers when they're doing procurement. Now back to pooled procurement. Pooled procurement is can take different approaches. For one, at the continent, at the EAC level, there's 24 products that have been prioritized for pooled procurement. The list is available online, and this list sort of demonstrates the priority funding, if you say, or priority strategies that are already being put in place for that. And so manufacturers can tap into that. We also realize that it's still in the very preliminary stages, and so it hasn't been unpacked well. So the financing bit around it, operationalization of it is still not very clear, but there are clear strategies around that. At the UNECA Africa Union level, there have been previous interventions to procure about 10 prioritized MNCH products. Again, donor funded. That piece of work is being led by UNECA. And the questioner can get in touch with me after this for more details around that. Yeah. Over to you, Anjiru.
Yeah, I think in terms of how we could better support local manufacturing, it's just recognizing, and we've mentioned the issue of regulatory harmonization. So that basically ensures that there's market availability for anyone who invests or chooses to put in capital to set up local manufacturing in the region. This accelerates product availability, market entry, market access across the region. It ensures that your investments are also safe. I think, we've already seen a clear demonstration of, for example, Global Fund procuring ARVs from a local manufacturer in Kenya, and they're procuring for the region. So this is already happening. It's happening through different strategies and interventions. So one, financing is important so that particular manufacturing has puts in the right investments, the right quality measures, the right skills and capacities, and also has that visibility of how big the demand is or how much it needs to supply. But it's also just ensuring that the policies, whether it's the trade policies, whether it's the regulatory policies, are also supportive of that local manufacturer. So this is already happening, and you're going to see more of that happening because there's a lot of partners, a lot of foundations and donors who are looking for local and regional resilience when it comes to health products and technologies for the region. And we're happy to share more examples. Hopefully, this could be shared either through SAPICS or BaseGuild, which is already platforms that you're signed on.
Thank you so much, Vanjiru. And thank you so much, all of you, and I would like everyone to, do a virtual clap to show appreciation to all the panelists who are gathered here today, and has given their valuable time in talking about this topic. We're almost at the end of this webinar, and I really appreciate everyone who has stayed back and listened for almost 2 hours. We only have two small segments where one, of course, I would invite Vanjiru to provide the key take-home message for everyone. And then we will also hear from Claire Fincham, who is the marketing manager at SAPICS. In between, I would launch a survey as well. So please do not log out before you fill out the survey. But as we go to that section, I would like to invite Vanjiru once again to provide the final reflection and the take-home messages. Vanjiru, over to you.
Thank you so much, Sanjay, and thank you for this platform. I think it was very enlightening for everyone, including the panelists, just learning new information. My key takeaways, or what I'd like to summarize, at least for everyone as they go about their next activities this afternoon, it's just to know that, or to recognize and appreciate that market shaping is not just about economics, it's not just about price. There's a lot of moving pieces, and just appreciating it's actually more about choreography. So we are trying to ensure that suppliers, the systems, the countries, the institutions are able to make these products available, and there are various things that needs to come into play. So when you talk about, we've heard about volume guarantees, we've heard about pool procurement, and just ensuring that this fragmentation across a very complex health system is brought together into one piece that delivers the product for the client. And then just appreciating that, yeah, we were talking about market shaping, but the first thing that comes into play is the assessment. So the market assessment definitely precedes the action of market shaping. If you want to appreciate it from a surgeon's perspective, first they look at the incision, and this is where the market assessment comes into play. So the roadmap before we even dare to disrupt or to do any sort of investments, creating a strategy to avoid any guesswork and to bring order into the current chaos that we are seeing, especially for our region. And then something more importantly, and it has come from each and every speaker today, is that, we might look at data being the new donor, or the new funding, or the new financing. So we've seen diminishing development assistance, and countries will just not need resources. They'll need to be more smarter in how they put in their strategies. So a lot of data-driven procurement is important. We talk about regulatory harmonization across the region. Health technology assessments will replace financing when you think about how the financing are dwindling, especially for our region. So sustainable procurement and availability of this product is not just, I would say, a buzzword for all of us today. I think it's our moral duty. It's ethical. It's the right thing to do. So we must have to think about being less transactional and more transformational when you think about our purchasing, our supply programs, looking more with a long-term vision and not just buying products, but ensuring that our community is provided with resilient supply chain for health products and technologies. So just to put it all together and just something for everyone to think about as they go, as a sign off, I think I saw something very important from Gates' platform and what Gates was saying in the last 24 hours. So for us, our legacy for our generation going forward, it cannot just be looking away as millions of patients, and more importantly, even children, die from preventable diseases where there are certain elements, tools, interventions that we can put in place. So one of the key interventions and tools that we can currently employ as health supply chain professionals is to look at how market assessments and market shaping can save lives, can change lives, and can make lives more comfortable for everyone. So thank you very much. We appreciate your attendance, and of course, we look forward to engaging with you in different platforms. Thank you, and back to you, Sanjay.
Thank you so much, Vanjiru. It was a really excellent reflection, and I think you summed it up well, that we have to think more from the perspective of what kind of legacy that we're leaving behind. Before I move to Claire for the concluding remarks, I would like my team to switch on the survey. So can we do the post-webinar survey? Yes, it's on your screen now. There are very quick 5 questions for you to see and answer. And while you are doing that, maybe let's take 10 seconds for them to read. And then Claire, I would like to invite you for the conclusion and wrap up of this webinar. I would also like to thank SAPICS for this collaboration and the beginning of this collaboration with this excellent webinar, where we have gathered such an expert panel from various countries. So Claire, over to you for conclusion and wrap up.
Thanks very much, Sanjay. Thank you to an amazing, efficient team for starters, for the partnership, which we look forward to growing, and for arranging the webinar and all of the work around that. So thank you to the B-Skill team. Thanks to the speakers for their excellent preparation, their presentation skills, and their amazing time management. I think there were great takeouts, as Andrew mentioned. So thank you for that brilliant wrap up. Just 10 seconds on SAPICS. SAPICS is an industry body that educates, elevates, and empowers individuals and organizations in supply chain management. We have membership categories, membership benefits, we have events, we have an annual conference, and we have an education program, of which B-Skilled is one of our partners. So I've put the website there for SAPICS and my email address. I'd encourage you to become members. It's quite affordable for individuals at 1,100 Rand per year. So that's about $80 for the year. And if you would like more information on what we do, please visit the website. And I look forward to hearing from you. And thanks again, everybody, for attending. It was excellent attendance. Thank you.
Thank you so much, Claire. And thank you all the panelists once again. And of course, that it goes without saying that, thank you to everyone who have joined today. I mean, we have consistently seen a participation of over 200 people throughout the last 2 hours. So that is a great achievement, I would say. I mean, that means all of you are really popular and people want to listen to you. Maybe we need to do a few more. So thanks everyone. We will send all these materials via email to everyone who had registered, and of course the Q&A, because it's just impossible to answer all the questions. So we will compile a very holistic document where all your questions and responses to those questions will be added, and they will be shared via email. Thank you again. Signing off from here. This is Sanjay Saha, and I would like to thank my entire team, Muskan and Shreya, for making this happen. And we welcome you to visit the Hive platform and the supply chain courses which are there, which are also mentioned in the chat from Muskan. Bye, everyone. Wish you a great day and the rest of the week. See you in another platform. Bye.